Good afternoon, and welcome to the Let's Talk Life Enrichment series. My name is Pastor Lauren R. Hodnett, and I'm your host for today. And we are so happy that you have joined us for this seminar this afternoon. This is a ministry initiative of the Ebnenezer Seventh-day Adventist Church located in Augusta, Georgia. And each and every month, we address issues that all of us have to deal with, and we discover ways to enrich our lives. And so we are just grateful that you have tuned in this afternoon. I'm so happy and excited about what we have in store this afternoon. We have an exciting topic, and we have a wonderful guest that will facilitate this afternoon. At this time, I'm going to bring in our health and temperance leader at Ebnenezer, Dr. LaShonda Hurst, and she will introduce our presenter this afternoon. Dr. Hurst?
Yes, Pastor. Good evening, everyone. I'd like to also welcome each of you to our webinar this afternoon, Let's Talk Life Enrichment series, entitled COVID Vaccination, Danger or Safety, What You Need to Know. We are excited that you have chosen to join with us today. I am honored, and it is a privilege to introduce our facilitator for the evening. Dr. Richard Berry is board certified in the specialty of internal medicine. He is a fellow of the prestigious American College of Physicians. He holds the position of Associate Professor of Medicine at the University of North Carolina in Chapel Hill. With these positions, he trains future medical doctors in the art and science of medicine. Dr. Berry is presently in the position of Chief of Medicine at Columbus Regional Healthcare System in Whiteville, North Carolina, and is licensed to practice medicine in the states of North Carolina, South Carolina, and Hawaii. Dr. Berry is the author of a number of health-related articles written for the South Atlantic Conference and published in a number of magazines, including Message Magazine. He is a church head elder, pathfinder, master guide, and the husband of one wife, Charlene. He has two beautiful adult daughters and a precious granddaughter, Anaya Eleanor. Finally, Dr. Berry considers himself a servant of God and gives glory to God and to God alone for all that he has done in this life. At this time, we'd like to welcome you, Dr. Berry. We will turn the program over to you.
Thank you so much, Dr. Hurst. It's a pleasure to be here. I'd like to thank Pastor Hodnett for inviting me to his church. Some ground rules here, first of all, before I begin. I like to see my audience, Dr. Hurst. I like to see people because I don't want to talk to a blank face. So if you could all turn on your video, it will be very good for me if you can, so that I can see you. I know that you probably have hair curlers in your ear and here, and don't have to worry about your bad breath or deodorant because that won't bother me. But go ahead and turn your videos on. It'll be helpful to me. I bring greetings from President Winston from the South Atlantic Conference, who is very interested in making sure our churches open up safely and on time. I'm going to share with you scientific information. When I'm giving you my personal experience, I'll tell you that. But most of this will be scientific information. I'll be giving you the means to make a decision, an informed decision of whether you want to be immunized or not. I will never force you to get a vaccine, but I'll give you the information so you and the Holy Spirit can work out whether you want to be vaccinated or not. I'm going to give a little short talk about COVID-19, and then afterwards, I can answer any of your questions. Let me get you up to date. As of yesterday, April 23rd, 2021, there were 31,770,000 cases of COVID virus in the United States alone. 13 million. Of that 31 million, there were 567,000 deaths from the COVID-19 virus. As of yesterday, there have been 222 million vaccines.
Hello.
Okay, I'm getting feedback from Maria. You want to turn off your sound? It's just your sound. Good. As of yesterday, there were 40% of the US population were vaccinated. That at least 1 in every 4 But still, as of yesterday, there were 63,000 daily new COVID cases. This is a big problem. And usually the people who are affected by this are older individuals who have severe underlying problems like coronary artery disease, COPD, diabetes, obesity. There are more problems with these individuals, and they develop more infections and complications, including ICU monitoring, intubation, and death. Now, this is important for me and for Dr. Hurst. More than 3,600 US healthcare workers have died in the first 12 months because of this virus. 3,600 healthcare workers, people who take care of the sick, have died because of this virus. There's some important terms I want you to realize. The first one is, what is the virus called? The virus is not called COVID-19. The virus is called SARS-CoV-2. SARS-CoV-2. The SARS means severe acute respiratory syndrome. The CoV is COVID virus, and the 2 is the second virus. So the virus itself is called SARS-CoV-2. The disease that SARS-CoV-2 causes is called COVID-19. CO for coronavirus, VI for virus, D for disease, and 19 was 2019, the year that this was discovered. But while I'm talking, I may interpose these two words, SARS-CoV-2 and COVID-19. So I want you to know the distinction about these two. The virus is spread primarily through respiratory droplets, person to person, respiratory droplets. Behind me, you see a copy of the virus. That's what the virus looks with an electron microscope. And do you see those projections there? These are called S proteins or spike proteins. I'll tell you more about that later on, but these are very important in transmitting of the virus. The virus is a virus that infects individuals through respiratory droplets, and sometimes it takes 4 to 14 days before you develop symptoms. Listen carefully now. If you're infected by the virus, it takes from 4 to 14 days before you are aware that you're infected. Do you see a problem here? It means that individuals could be infected and not know they're infected. Therefore, they can transmit the virus. That is why it's so important for us to follow through some recommendations, and I'll talk about that in a little while. What are some of the symptoms of the viral infection? The big one is memory fog. Memory fog. It is where the virus infects the body and you have short-term memory loss. You feel tired, fatigued. You do not know why your muscles are aching. You have a cough. You lose weight. Sometimes you lose the sense of smell because the first place the virus infects is your nasal cavity. You have a fever, nausea, vomiting, and diarrhea if the virus goes into your gastrointestinal system. So all these are symptoms of the virus. But the big one I want to stress on is memory fog, because we found out that with the immunization, this goes away. A Harvard study done in 2020 shows that there are a number of things that can improve our resistance to the virus. Now, this is important. You see, nothing can cure the virus, but if you have a good immune system, that'll help fight off the virus. And according to the Harvard study, not the Loma Linda study, the Harvard study, if you do these things, these 5 things, it'll help you increase your immune system. 1 is stop smoking. 2 is a vegetarian diet. 3 is exercise. 4 is weight loss. And 5 is decreased stress. And what are we doing today in regard to that 5th one? What are we doing on the Sabbath day? Are we decreasing stress? Yes, we are. And according to Harvard study now, decreasing stress helps our immune system. Also, a vegetarian diet. As I said, this is not Loma Linda or Andrews. This is a Harvard study. We will speak on this later because I'm going to give you some advice on what to do if you're infected with the COVID virus. So how do you protect yourself? I'm going to give you 5 ways to protect yourself. The first one is masks. I have here an N95 mask. You know it's N95 because it says so, N95 mask. The N means the filter class. N is not resistant to oil. R is resistant to oil, and P is oil proof. So when you have your mask, make sure you look and make sure it has an N, an R, or a P. The 95 is really the efficiency level. 95 of the organisms are prevented from getting into your nose. 95%. This is the CDC recommended mask, the N95 mask. But I also have this mask. Have you seen these masks around? These masks have valves. These valves prevent the virus from getting into you, but when you breathe out, you're breathing out what's already inside of you, therefore it doesn't protect those around you. These masks are not allowed on aircraft. Airplanes will not allow these masks because if you are carrying the virus, you can breathe out the virus and those around you can be exposed. But I find this to be very efficient for me when I'm not traveling on the plane. But this is what you most likely see here, surgical masks. These are efficient, not as efficient as the N95, but sufficient to go ahead and prevent you from being infected. Some people believe in double masking. The CDC has not made a ruling on this. Some professors and healthcare workers believe in double masking, and there's nothing wrong with that. But according to the CDC, they have not said that you should do that at this point here. On your mask, if you look at your mask, your N95 mask, you may see that something says KN95. The KN95 is the Chinese standard of efficiency, KN95. The FFPE is the European Union standard. So if you look at your mask and it says FFPE or KN, these are standards for different nations. The N95 mask filters out of particles that are greater than 0.3 microns, very, very small. So the first one is mask. The second one is ultraviolet light. I bought this. This is an ultraviolet machine here. When I travel on airplanes or when I go to hotels, I carry this. You turn it on and an ultraviolet light comes up and I swipe the telephone, the doorknobs, anything that I will touch. It kills the virus, it kills bacteria within 15 seconds of it. It is UVC light, not UVA or UVB. It's UVC light. That is the light that kills. It has the shortest wavelength and it kills. I'd advise you, especially pastors who do a lot of traveling to hotels, to get one of these portable ones here that you can sterilize your hotel or where you go. So UV light is one of the big things that I carry around to help counteract the virus. The third thing is physical distancing. Now, have you guys measured out how much 6 feet is? It's amazing how people don't know how close or how far 6 feet is. When you get a chance after this lecture, go and measure 6 feet. It's a big 6 foot. Therefore, you should have people 6 foot and further away from you, because when you talk, for example, I used to teach biology, and I noticed that my students would never sit right in front of me. They would sit to the side or way back, till I found out one student told me, Dr. Berry, when you talk sometimes and get excited, you spit. Well, I was spitting around the classroom, and the students said they didn't want to be in front of me. Many times we talk, and the words, when we get excited, come out with little dropules of saliva. Well, if the virus is in those dropules, you can spread it to somebody else if they're not 6 feet or more away from you. So number one is 6 feet, physical distancing, avoidance of crowds. A new study came out by the JAMA, Journal of Medical Association, that shows that we may not need to wear masks outside, so long as we're not in groups. Because wearing masks outside where the sunlight is there will kill the virus, kill the bacteria. So if you're outside by yourself or with family members who have been immunized, you don't have to wear masks. Just unless you go into crowds, then you got to wear the masks. I've advised the president of South Atlantic Conference that when we open our churches, we should enter and leave in different areas. Enter through the front door, but leave through the side door or some other door where we don't go through the same place we're entering from. And no more handshaking and hugging like we used to do. And I'm a hugger, but no handshaking. You do your elbow or your fist, but no more handshaking. And make sure each church has a lot of hand sanitizer around. And families should sit together. It is important also for you to realize that washing of hands, this is number 4, washing of hands is important. Yes, you have the hand sanitizer. Go ahead and use the hand sanitizer, but go ahead and wash your hands. If you go to a restaurant and you see that the cook enters the bathroom and leaves the bathroom without washing your hand, leave the restaurant immediately. You don't want to taste that food, okay? So washing of hands is important. We as a nation are cleaner than 1 year ago or 18 months ago. We're washing our hands to the point that I'm seeing patients with eczema. They're having their dry hands and they're coming to me. So what can I do? They wash their hands 4 or 5 times a day. They use hand sanitizer. It dries out the skin. So washing your hands is important. And the 5th one is, so we're on the 4 ones so far. We have had UV light. We have had masks. We have had washing of hands. We have had distancing. Then the 5th one is vaccines. There are 3 vaccines available. The first one is called the Pfizer vaccine. It came out first. The Pfizer vaccine is an mRNA vaccine. It's a nanomolecule. It's a very small molecule, a fat molecule really, that has in it the blueprint of part of the virus called the spike proteins. These spike proteins are made of amino acids, and they put the mechanism of making these into these nanomolecules. They inject that into your muscle, and the muscle produces the spike protein that the body reacts to. The body reacts to it, and by doing that, it produces antibodies. So the immune system, your immune system, is producing these spike proteins that your body reacts to. If you don't have a good immune system, this can be very devastating for you. And I'll talk about how you can improve your immune system. So the Pfizer vaccine uses mRNA technology. It came out first. It's 2 shots, and the shots are 28 days apart. The second one is the Moderna vaccine. The Moderna vaccine also uses mRNA. They're 2 shots, they're 21 days apart. You see, what happens is this. The virus, when you sneeze, gets into your nasal cavity of somebody else. And these spike proteins here grab on like a key into the knob of your cells. They open up the door of the cells, and what is in here moves through the spike protein into the cells, infects the cell. The cell doesn't know, is not familiar with it, so it starts producing more and more of these. The body doesn't have a defense mechanism to fight these off, so it starts an immune system where all the cells start producing fluids to try to neutralize this. You're really not killed by the virus. You're really killed by the body's response to the virus. More fluid gets into your lungs. Fluid builds up in your lungs, and in a sense, you drown on your own fluids because the body does not have enough antibodies to fight this virus off. So we've talked about the Pfizer vaccine, the Moderna vaccine. The third one that's approved is the Johnson & Johnson. Now, the Johnson & Johnson was approved for treatment or immunization. It is an mRNA vaccine that's given to us through the adenovirus. It's a adenovirus that has been inactivated, a common cold virus that has been inactivated. Well, on the 13th of this month, what happened was the New England Journal of Medicine came up with a study that showed that there were 6 women ages 18 to 38 that developed low platelet count and clots in their brain. Because of this, there was a halt of the Johnson & Johnson vaccine for 13 days. As of yesterday, the CDC and FDA have approved to start giving the Johnson & Johnson vaccine again, as of yesterday. Now, I need to tell you about this. If you didn't get the vaccine, if you got infected by the virus, you can still develop low platelet count and blood clotting. The low platelet count is important because that prevents blood clots from forming. We don't really understand the full mechanism. And clots can form anywhere in your whole body, including your brain. And that's without the vaccine. But they found out that with the vaccine, there were 6 cases, and really there were 15 cases. When they studied, there were 15 cases. And of those 15 cases, there were 3 deaths. Now, you got to think of the risks and benefits of the vaccine. Without the vaccine, you can get the virus that can cause the same problem as with the vaccine. However, the vaccine has been proven to prevent hospitalizations, ICU admission, and death. It is not 100%. None of the vaccines are 100%. Some of them are 95, some of them are 98, but none are 100%. But the benefit significantly outweighs the risk associated with this. All medications, all vaccines have potential side effects. All of them do. And Johnson & Johnson is no extreme to that. They say, though, it happens in the first 14 days of an inoculation, usually in women and usually in young people. So if you have had the Johnson & Johnson vaccine and you've had it more than 1 month from the time, you really have nothing to worry about. It is those young people who within 14 days of getting the vaccine have headaches, red spots on their legs, nausea and vomiting, sometimes swelling of the legs. If you have any of those symptoms, don't wait around. Call your primary care provider or go to the emergency room for evaluation if you've given a shot of Johnson & Johnson. The good news is that Johnson & Johnson is one shot. Some people don't like injections. I love giving injections, but I don't like getting them. Well, sometimes you want to give just one shot, and that's the Johnson & Johnson. A fourth vaccine, which has not been approved in the United States, is the AstraZeneca. It appears that the AstraZeneca uses an adenovirus for the chimpanzee family. It is an adenovirus that is only associated with the chimpanzees and gives them infections, but not to humans. Well, they have modified that vaccine, modified that adenovirus. They've put the spike protein in it, and they've given it to individuals, but there have been more cases of low platelet count and clotting than in the Johnson & Johnson. So we have 3 vaccines available, the Pfizer, the Moderna, and as of yesterday, the Johnson & Johnson. I am more concerned about variants. You see this spike protein. This spike protein is made of amino acids. And the longer we waited to produce antibodies, the more this changed and produced variants. The amino acids were changed. It changed its shape. And because it changed its shape, it is more infective and more devastating than the original virus. More devastating. There's one called the B117 that is from the United Kingdom, a variant called B117. There is the B1351 from South Africa, and there's the Brazilian. The Brazilian one is in New York City. These variants have a change in their spike protein to the point that the inoculation we have does not do it as well as the original. All studies so far, all of them so far, show that the 3 vaccines we have do take care of the majority of the variants. So still get the vaccine. Now, if you have not been vaccinated and you come down with COVID-19, if you're COVID positive, what can you do? Well, according to the CDC, you should be quarantined from 10 to 14 days. You can take Tylenol for your aches and pains, but you should not take anti-inflammatory medications. No BC, good powder, Addison Aleve, Motrin, ibuprofen, because those suppress your immune system. Remember, we want your immune system to be up to par as much as possible. Now listen carefully what I'm about to say. Scientifically speaking, there have been no double-blind studies that show that vitamin C, vitamin D, zinc, or water increases your protection of COVID virus. No scientific double-blind study. I'm speaking now from myself and my practice. If a patient comes down with a COVID virus, I give them these medications because I have seen in my practice that vitamin D, vitamin C, zinc, and vitamin E helps improve my patient's outcome. Within 24 hours of taking these vitamins and these chemicals, my patients improve. But as a scientist, I got to tell you, there have been no significant double-blind placebo-controlled studies. But in my practice, as a physician, I use these all the time. I myself take high doses of these things. I'm not telling you to do it. I want you to talk to your healthcare provider and decide yourself. But these medications, vitamin C, vitamin D, vitamin E, and zinc have helped me and my patients in my practice if you're COVID positive. Also, an aspirin. Now, a study came out that an aspirin does seem to help prevent the blood clots associated with if you're infected. There have been only 2 studies that shows that there are 2 things that have been proven to improve your immune system. 2 things. One is rest, Sabbath day, and 2 is exercise. I have 3 studies that show that these 2 things have been proven to improve your immune system: rest and exercise. Okay, now, if symptoms persist, my patients who come down with the COVID-19, there's a thing called adult monoclonal antibodies. If my patient comes down with COVID-19, I immediately send them to the hospital as an outpatient, and they get what is known as monoclonal antibodies infused in them, 1 bag of this, and by doing that, it helps them with the symptoms. It destroys the virus. Monoclonal antibodies. If you like to find a place where you can get the vaccine, most pharmacists seem to have the vaccine available, and some pharmacists you don't need an appointment. But if you have a problem finding a pharmacy that does it, you go to Vaccine Finder, Google Vaccine Finder. So we have a problem. We have the solution to solve the problem. What we have to decide now is, do we go with the solution or not? At this point, I'd like to open up for some questions. Any questions that you have?
If you have a question, just please put it in the chat, whether you're on Facebook Live or YouTube or on this platform. While we're waiting for people to ask a question, I have one. Dr. Berry, which vaccine would you recommend?
Okay, according to the CDC, the vaccine that's available should be used. I believe there's going to be some precautions, however, with the Johnson & Johnson. I think they're going to recommend those over age 50 to receive the Johnson & Johnson. It's a 1 dose, 1 vaccine. There's going to be some hesitancy with those under age 50 at this point. I got the Moderna. I got the Moderna vaccine. I got the 2 shots 21 days apart. And what happened was the first shot was fine. The second shot, I developed some nausea, some vomiting, and some fever and chills, but they lasted only like 12 to 24 hours, then went away. My wife, however, and I'm so disappointed in this, my wife had no problems whatsoever. There were no problems. She did fine. She said, "What's wrong with you? Why are you doing this?" She was fine. And most of my female patients did fine. I don't know why. I probably needed a study on it, but they did fine. But my male patients, they suffered for 24 hours. I told them, the day you take the vaccine, especially the second one, take an extra strength Tylenol if it's not contraindicated. Take an extra strength Tylenol that day, that night, and 2 the day afterwards, and they did fine.
All right, Dr. Berry, we also have another question. The question is, my concern is the long-term effects, and also does Ivermectin work? Okay,
there have been, yes, it does. Long-term effects. We have been doing this now for the past 1.5 years. There have been over 400 million people have been vaccinated. So worldwide, there have been a lot of 44 million people here in the United States. Approximately 40% of the population has been immunized. Is it 100%? No, I need to tell you that. It is not 100%. There are potentials. We just found out on the 13th that Johnson & Johnson had people who had low platelet count and clotting fibers. That is a known now side effect of the medication. However, the benefit significantly outweighs the risk. Any medication you take, any medication, any vaccine has risk. Any one you take, the flu vaccine, anyone they do. However, the risk of getting infected with the COVID virus, developing CCU symptoms, and death are much higher than the risk of the side effect, especially if you have a good immune system. And I do stress, good immune system. You need to think about becoming a vegetarian. You need to think about becoming a vegan. You need to think about adding all these vitamin C, vitamin D, vitamin E to your diet to make sure you get into sunlight. Very important. Drink your water. That will help.
All right, Dr. Berry, we have another question. If you already had COVID-19, should you still get vaccinated?
According to the CDC, if you've had COVID vaccine, after 4 weeks to 3 months, it's 4 weeks to 3 months, you should get vaccinated. Because remember, the vaccine is specifically for the spike protein. So we want to make sure that that is the specific where you're vaccinated. but they say wait 4 to 3 months.
Okay, next question. Why is there a reluctance of the African-American Black community in taking the vaccine?
Yes, there have been a lot of resistance in the African-American community because of what has happened in the past. But I need to tell you, a lot of our Caucasian friends are grabbing at this. A lot of our Caucasian friends are grabbing at this. The African-American community needs to be aware that we cannot be last. We need to be first in this. We need to get out there and we need to get the vaccine to protect ourselves and our community.
Okay, we have another question, Sister Scarlett. Now they are talking about getting a booster yearly. Also, I read a study that all of the people who died had low vitamin D levels.
Vitamin D is essential, I believe, to prevent the COVID virus. Now remember, it can't cure it. There's no cure for it, but I take high dose of vitamin D every day. I'm not telling you to do this. If you want to do that, please talk to your healthcare provider first before you do anything, because high dose of vitamin D are not good for you. But I take high dose of vitamin D because it interferes with what was the first part? What was the first question, part of the question?
It's now they're talking about getting a booster yearly.
A booster. Right now, Pfizer and Moderna have shown studies that it is safe after 6 months. Remember, we just really started doing this regularly in the population 6 months ago. So we have shown that. However, because of the variants, especially the 117, especially because of the variants, we may have to get a booster each year, like the flu virus. We're not exactly sure of this yet. According to the CDC, they have not made a decision yet. But I see that probably every year we may have to get a booster to counteract the variants that are developing because of our lack of quick response to this last year.
Okay, we have another question. What would you say to those who state that the vaccine changes the DNA?
Okay, the Moderna virus, the vaccine, the Moderna and the Pfizer vaccine are RNA vaccines. They do not go into the nucleus of the cell where the DNA is. They go into the cytoplasm of the cells and go on what's known as a ribosome that produces the protein. So they do not interact at all with the DNA of the cell. The Johnson & Johnson uses an adenovirus that also goes into the cytoplasm. It does not go into the nucleus, therefore it does not affect the DNA.
Okay, thank you. It says now, let's see. The next question is, there are many Indians in India that are vegetarians and are very religious too, but look what is happening over there.
Yes, it is not 100%. I can only give you the statistics of over here in the United States. And I'm telling you, at this point here, because of what's happening with the variants, the virus is getting more aggressive, causing more CCU and more deaths in the United States itself. The statistics in India are very bad. However, I can only focus on the United States and Canada.
Another question, why is there no compensation for deaths?
Who are you going to get a compensation from?
Actually, there is. They are paying for people who have died. The government is giving some compensation, and I can pull that up for you.
Thank you. I did not know that. But remember, we want to prevent the death.
Yes, of course. Okay, next question is, what's the dose recommended for vitamin D daily?
Okay, the dose is less than 1,000. I take 40,000 international units of vitamin D every day, 40,000. But that's a lot. So 1,000 is a dose. I tell my patient take 5,000. It's vitamin D3, 5,000 international units once a day. Vitamin D3, not D2, D3, 5,000 international units once a day at a minimum. I found that a lot of my majority, 99% of my African-American community are vitamin D deficient, especially over the past year, because we have not been going to the sunlight. We've not been getting that vitamin D, natural vitamin D from the sunlight. So especially my African-American patients are deficient in vitamin D. So I recommend that they take vitamin D3, 5,000 units, one a day.
Another question, Dr. Berry, thank you for your study. When the shot started, we did not hear that it would only last for 6 months. So we'll need it every 6 months to a year.
No, the shot does not last 6 months. The studies they've been doing show that so far of the 6 months, The studies are ongoing, but they can document up to 6 months that it's efficient. In another 6 months, they may say up to a year. But right now, the shot, as of 6 months publication, CDC says that it's handling it. We're praying that it will last a lifetime. But at least right now, we can document at least 6 months, because that's what the study time is. The study time is 6 months. They're doing it for a year and keep on doing it. But so far, it is 6 months have been guaranteed.
Dr. Berry, another question. What would you say in regards to church members who state that Sister White is against vaccinations?
Well, believe it or not, I did some research, and Sister White got the smallpox vaccine. So they're not reading the same text I'm reading. Sister White got her smallpox vaccine and did recommend that smallpox vaccine be given. There was no COVID around Sister White's time, therefore I can't answer that question, but she did get the smallpox vaccine.
Okay, another question. How long the vaccines is effective in your body? My husband had the shot and he has been having problems with his eyes, not being able to focus. Is that one of the side effects?
There are many side effects of the vaccine, but there are more side effects of the virus itself. In fact, it's the mental part of if you get infected with the virus, you can have slowing of the mind, you can have eye changes, you can have ear changes, and problems with smell. It all depends where the virus focus its attention on. Getting the vaccine does seem to help with this fog that they have in their brain. It can also help other symptoms, but it's not 100%. There have been other cases that presented, including the low platelet count and the low clotting factors, that show that it's a still ongoing process. I must stress, it is not 100%. It is the best we have to prevent hospitalization, CCU monitoring, and death, but it's not 100%. But that doesn't mean we need to stop taking it. I've had patients who died in automobile accidents wearing a seatbelt. Do we stop wearing seatbelts? No, we still wear the seatbelts because it's the best thing we have to protect us, but it's not 100%.
Okay, we have a statement. I also recommend that women hold off on mammogram for about a month after receiving the shot. This is from Sister Scarlett.
Okay, recommendation.
Okay.
Okay, Sister Scarlett says FEMA is reimbursing up to $7,000 for COVID-19 funerals to any family member who paid for a funeral. Please keep funeral documentation, COVID-19 funeral assistance, and it gives the FEMA, http://FEMA.gov, some websites. If you would like to get those, we can have those for you later. That was from the church, not Sister Scarlett.
And that's very important to realize that when you have your death certificate for the person who died, it must say as one of the causes, COVID associated. If it doesn't say that, FEMA cannot pay for it. So make sure you talk to your physician who signs a death certificate. It should have COVID involved in the death certificate, please. But I want to stop this death.
Okay, are you aware of any studies looking at Adventist and COVID-19 response to the infection, pardon me?
Yes, I am, but not just Adventists, because there are many Adventists who eat meat. There are many Adventists who are not vegetarians. There's a study being done right now at Loma Linda University that's looking at Adventists who are vegetarians or vegans and their response to the COVID virus and immune system. It has not been published yet, but I recommend highly, very highly, that you really consider becoming a vegetarian or a vegan to help boost your immune system. This is not the last time we're going to have a virus like this. Scripture tells us worse is going to come. So you need to have a good immune system to fight off these viruses, these bacterial infections. Become a vegan or a vegetarian or a pescatarian at least.
That's all the questions I have for you right now.
Can you address can you address whether, I'm tired of type, can you address whether one mask, two masks, I know you talked about the mask with the one-way valve, but address the 1-2 mask thing. I'm on 2 meetings here.
If you're inside, you need to have, or outside really, with groups of people, you need to have one of the protection is a mask. The best one is the N95. There have been studies that show that double masking is good because it prevents more of the virus from getting to your respiratory system. But it also is suffocating. Many of my patients have increased carbon dioxide in their blood when I test them because they're breathing and rebreathing their own CO2. So yes, it is the best thing, but according to the CDC, they have not mandated double masking. When I fly, I wear a mask and I also wear a shield that covers my full face. When I fly, I do that because I'm protecting myself from those around us in close proximity. You can't stay 6 feet away when you're flying. So I wear my mask and I wear my shield. But I cannot say that the CDC recommends that you wear double masking. It is only recommended by a number of physicians in the community. Nothing wrong with it.
Dr. Berry, may you also cover, readdress, which I think you've already mentioned. Once you're vaccinated, it's important that we continue to wear a mask. For how long?
Okay. I had a great time when I was vaccinated. 2 weeks after I was vaccinated, I had the opportunity of hugging my mother-in-law and kissing her in the cheek for the first time in 12 months. It was great because she was also vaccinated in 2 weeks after. Remember, you are only 95% protected by the vaccines 2 weeks after your last injection. It is only 2 weeks after your last injection that you're 95% protected. And I had the joy with not wearing a mask, going and hugging and kissing on the cheek my mother-in-law, because I had not done that in over almost 12 to 13 months. So yes, when I'm with her, I don't wear a mask. When I'm with my wife in my home with my family, I don't wear a mask. When I go out, I always have a mask in my pocket, and I wear the mask. I do as much physical distances as I can, and I have my hand sanitizer with me. When I go to Walmart, I use their hand sanitizer, and I wipe down the what's that thing called, the trolley. I wipe it down and I push it around with my mask on. I don't touch my mask. I don't touch my face. But if I got the vaccine, if I had a vaccine, there's a study that showed that there are individuals who were vaccinated who cannot get the virus. It doesn't attach to them. Somehow it doesn't attach to them. So you are at increased benefit of getting inoculated with the vaccine to prevent you from having the symptoms. All 3 vaccines have been proven to prevent deaths, hospitalization, and severe problems from the virus.
Dr. Berry, we have another question. So what would you say to those who are worried about the effectiveness of the vaccine, being that it was rushed to production? Well,
it wasn't really rushed. There were 40,000 individuals in these studies that were done. The new technology is what got me. I understand that question. It is a very good question. But the technology that's using has been around since 1980. It is nanomolecules. Nanomolecules are small fat molecules, microscopic, that house the mRNA. It's new technology. This is around 1980 that goes into the muscle. So it's been a short time, but it's the Bible. The Bible says knowledge shall increase. What we did in the past year was inconceivable, but because of the knowledge that man has and scientists have, we could do it. And I trust the science.
What is your advice on African Americans, Blacks participating in medical vaccine trials?
We need to have more African Americans involved because we want to make sure that population is covered when it comes to vaccines and medications. The Caucasian community can have their vaccines and stuff, but we need to have input into these vaccines, these medications, so we can know that it's safe in our community. Yes, go ahead and go in the vaccines.
Another question, any studies on the drug Ivermectin being used to fight COVID?
Yes, very successful. In fact, there is a study that shows that the medication, if given in one bag, one dose, in fact, an injection can also decrease the risk of getting totally infected and getting symptoms by at least 80%, 80 to 90%. Yes, very helpful if your hospital has that.
Okay, where can we get Ivermectin?
Most hospitals have it. I don't think clinics have it at this point here, but most hospitals have it. And as I said, you don't need to get it if you're immunized. But if you are not immunized and develop the COVID symptoms, go to the emergency room. There are a number of modalities that are emergently approved. I need to stress this, emergently approved, because they're still going through the trials that can be used to alleviate your symptoms. Talk to your primary care provider.
Another question. So with these nanoparticles, what are the capabilities that arise from this engineering? Should we be concerned about the genetic engineering as we are with foods?
Of course, we should be all concerned. But right now, the present is that we need to get this into the muscle. And we can't take it by mouth because it's a protein. If you took it by mouth, the enzymes in our stomach will dissolve it and it would be worthless. So you got to inject it into our muscle so they can produce it. The nanoproteins are really fat molecules that have no porcine, no bovine influence in it. And inside those circular fat molecules is the mRNA that goes into the system, goes into the cell. The cell produces the spike protein. It puts it onto the top of the cell. The body sees that and immediately starts producing antibodies to that spike protein. So the nanomolecules is a new technology that's working, and we believe that it will work for other medications too.
Okay, I don't like needles. Is there another alternative? Is a question.
Okay, there's no other alternative to getting the vaccine but by needles, and I told you why. They can't take a pill because the pill is protein, and when you eat protein, the body digests the protein. So you can't take it in a pill. You can only take it in. And I don't like, as I said, I love giving injections. I just don't like getting injections. So I too don't like injections. That's why the Johnson & Johnson was so effective. You just need one shot. And I'm telling you, if you get a good nurse, you don't even feel the shot till afterwards when they begin to have some pain at the shoulder. So don't worry about the shot. Worry about what's going to happen 5 minutes afterwards when the swelling occurs.
Okay, I think this is a repeat question, but it says, what is your advice on African-American Blacks participating in medical vaccine trials?
Yes, we need to have input. We need to have input into the scientific community. We don't know how it reacts to the African-American community. Yes, I'm for it. Make sure that it is known what they're doing. I don't think we should experiment with African Americans by just doing stuff without them knowing what they're doing, like they did in the 1920s. So make sure you know what you're doing and sign all those contracts to make sure you know what you're doing. They're just going blindly. Remember the Tuskegee experiment? They didn't know what they're doing. So yes, if you know what you're doing, I need the African American community to be involved in the scientific research.
Can you address pregnancy and the shot?
Okay, there's a study going on right now by the CDC and by Duke and Chapel Hill about pregnant women and getting the vaccine. There have not been any, the CDC does not have any recommendations right now for those pregnant or those less than 12. No recommendations at this point here. However, there have been research and publications that show that it does not affect the fetus or the mother. But the CDC does not have a recommendation right now about whether or not to immunize pregnant women. But as I said, I've read papers that show that there's no bad effect on the fetus, but there's a study going on right now to prove that.
Dr. Berry, we are aware that there is a new strain from Africa. What is your recommendations concerning that strain if you've already received the Moderna or the Pfizer, and will you be able to, will this fight off that strain?
There are a number of strains, but the three big ones are the one from South Africa, the one from Britain, and the one from Brazil. Those are the three variants. Remember, the variant means that this spike protein has changed so that the medication we give them for this spike protein may not affect the virus. However, all the studies so far show that it is effective in the variant so far. No study shows that it's 100%, but still it is effective. So still, even though you get the vaccine, make sure you wear a mask, physical distancing, washing your hands.
I think this too is a repeat question, but it says, not sure if this was answered. Have you heard of anything about the medication called Ivermectin being used to fight COVID?
Yes, but it is an experiment. It's an emergency use of it.
Are there any additional questions? You can place that in the chat at this time.
Okay, can I tell you why I got the vaccine? Okay, I'm going to conclude with this. Okay, 1 Peter chapter 5 verse 8 tells us that the devil is going around like a roaring lion seeking who he can devour. The COVID-19 epidemic was not by chance. I personally believe that this epidemic, this pandemic, was not by chance. It was a calculated problem by the devil to try to kill as many as he could. And he almost succeeded in doing that. There have been millions and millions of individuals. In the United States alone, 580,000 deaths from this COVID virus. And many of them Seventh-day Adventists, leaders of our churches. The devil tried his best. He tried to close the churches down. People weren't going to church. They were staying home. They weren't evangelizing. He seemed to be successful in preventing the message of a soon coming Savior from going out to the world. We need to make sure that we are immunized so that we can go out in this world free to make decisions, free to seek people out and talk with them. I took the vaccine because I wanted to be able to go out in the community to speak to people, to talk to them and not worry about my health. The Lord cannot use you if you're in a hospital bed or you're dead. You need to be alive to be a missionary in this world, to finish this work so we can go home. I got the COVID virus vaccine because I wanted to be able to go out and think that the Lord has blessed me. The Bible tells us that worse is going to come upon our world. We need to finish this message and go home soon. That's why I took the vaccine.
Last question, Dr. Berry. What are the side effects of the vaccine, and can you get any other illness from the vaccine?
There's not really side effects. It's the direct effect of the vaccine. When you get the vaccine, the body starts producing antibodies to fight off the virus just in case you're infected. It does not prevent you from getting infected. The vaccine prepares your body in case you're exposed to the COVID virus. Therefore, you can have pain at the site of the injection. You may have a low-grade temperature. You may have a fever. You may not feel well for 24 hours. As I said, when I got the second vaccine, I had fever and chills for 12 hours, and then it went away. So these are the direct effects of the vaccine preparing your immune system. Some of my patients developed lumps under their arm because of the lymph nodes there that were being used to produce the antibodies. You want these things because this is the way of the body showing that it's doing what it's supposed to do.
All right, we do have one additional question. What was the treatment that President Trump received?
I think he got the Pfizer.
Can I just say something, Dr. Berry? Thank you for your presentation. And also, I'd just like to say, you made a point there. You can.
You just muted. You just muted yourself.
Sorry. Yeah, I'm sorry. You made a point there that I'd like to emphasize, because people have the impression that just because you get the shot, you cannot get COVID. You can get COVID, but it does not protect it, but you won't get as sick. And that's something that people have a misconception, that you can't get COVID afterwards. I see that every day in the clinic. So, you know, they need to know that. Just still do your hand washing, but you won't be as sick. And sometimes the symptoms that you get from the COVID are life-changing.
Okay, I don't know what happened there.
We have no other questions at this time. I too like to thank you, Dr. Berry. You have done a phenomenal job, an excellent job in covering multiple topics with this pandemic. Thank you so very much. Do you have any other closing statements?
No.
Okay.
Pray about it, talk to the Lord, listen to the science, not the Facebook, listen to the science, and then make a decision.
Thank you so much. We'll turn the program over now to Pastor Hodnett.
Thank you so much, Dr. Berry. We appreciate you stopping by and sharing that with us, information with us, with some very good information, and we appreciate it. And we look forward to bringing you back to speak on some other subjects. I believe that you have some other topics. Just share just a few of those with us.
Well, I speak on high blood pressure, diabetes in the African American community. I have a whole team that does talks to different churches.
Okay. When we can open, we would love to bring you in person. And if that's okay with you, Dr. Hurst, and we would love for you to share with us. But thank you so much. We appreciate it. Just a few things before we close out. We want you to know that our next installment of Let's Talk Life Enrichment series will be May 15th at 5 o'clock, May 15th at 5 o'clock on these same YouTube and Facebook channels. And our topic will be Call Me, God's Ideal for Human Sexuality. Call Me, God's Ideal for Human Sexuality. And this is a program that is especially geared to our young people. We have a dynamite panel of young adults who will be sharing and just some of the pitfalls that young people face and how they can avoid them. So we invite you to tune in May 15th at 5 o'clock for the next installment of Let's Talk Life Enrichment series. Also, we want you to know that we are here at the Ebenezer Seventh-day Adventist Church to assist you in any way we possibly can spiritually. And so we invite you, if you have a prayer request, this is something that we can help you with, you can call us at 706-738-738-1119, 706-738-1119. Leave a message and we'll be happy to get back with you. Or you could email us at EbenezerInfo202@gmail.com. EbenezerInfo202@gmail.com. Share with us a prayer request or any spiritual concerns that you have, and we'll be happy to get back with you, happy to share with you. We are here for you. Once again, thank you so much for joining us this afternoon. Thank you once again to Dr. Berry, to Dr. Hurst, and we look forward to seeing you next month, May 15th, at 5 p.m. as we discuss the topic, Call Me, God's Ideal for Human Sexuality. God bless.